cholinergic urticaria. There may be exercise can induce these types of cholinergic urticaria. Different causes are there.
Okay, different causes are there, and many times the causes are also unknown, doctor, and it becomes really difficult.
Most of the time it is unknown. Most of the time it is unknown.
Okay.
There may be wheals, there may be angioedema, it may be spontaneous urticaria, it may be physical urticaria, it may be other types of urticaria, like what I told you, like cholinergic urticaria. Suppose the core body temperature has been increased due to exercise, then it can cause urticaria. That is called cholinergic urticaria. There may be some contactants may be there, which can elicit urticarial symptom, which can trigger the disease also. There may be anaphylaxis also, maybe due to physical exercise.
Okay. So n number of causes can be responsible for urticaria, and most of the time, as you said,
very interesting. If you can find out the cause of urticaria, then you will feel, yeah, I have done something.
Like a big achievement.
Yeah, big achievement. Sometimes patients say that when I go to bath in cold water, I feel that I am getting swelling, and I just come out of the bathroom, it vanishes.
I'm okay.
So it is cold induced.
So that is the trigger. The cold water is the trigger then.
Some was taking ice cream, so she has just put the ice cream on his or her hand. There will be swelling. So that is cold induced urticaria.
Oh, very interesting. So that means it's very important for the patient to understand at the first place that, what difference in his life, in his or her lifestyle is causing the trigger. Okay. Doctor, what happens, many a times when a person is having some kind of skin infection, allergy, whatever, they'll first try for some home remedies. They'll try to apply something in case, as you said, that in urticaria, it's very itchy. So many times people, apply aloe vera or something to just calm it down. Then they'll go for some over-the-counter, application. They'll go to a chemist shop, ask for some over-the-counter medication. And after, when the situation goes out of control, that's when they go and consult a qualified doctor. My question to you is, do these home remedies or over-the-counter medications work? Or are they okay to go for it? Or is it really important to go and consult a doctor at the very first place?
Actually, it is better to consult the doctor in the very first go. Otherwise, it may become very worse, may cause other things. It may cause acute itching, can cause secondary infection, bacterial infection also. And you actually don't know the cause when it will exacerbate more. There may be some breathing difficulty, there may be difficulty in deglutition, that may cause some angioedema. Then the problem comes, whole lot of problem. So it is better to consult a doctor first, qualified doctor.
Right. And when a person comes to you with, these symptoms where they have these lesions, raised bums, and it's very itchy, what's the first thing that you do as a doctor? Do you go for tests or something to diagnose, or how do you set the line of treatment, doctor?
First thing is to give some relief to the patient. Usually we give some antihistaminics in the first go, whichever it may be. If there is some respiratory symptoms like breathing difficulty, we go for Montelukast also. If it is very acute, we can go for other treatment like steroids and other things also. But first we try with some terms are getting reduced or not. If it is not reduced, then we have to go for other things, and then comes the question of test. We first take the proper history of the patient is very, very, very important.
Okay.
What work, what job he or she is doing, whether what type of food he is taking, whether she or he has taken any other type of foods, any outside food, any street food, any contacts, any history of contacts, any pets are there or not. All these are very important. What are the habits? There may be habit of nail biting. So there may be worms also in the abdomen that may also cause this type of urticarias. And what type of medicine the person has taken in recent times, that is also important. Whether he or she is using any hair dye. I have seen one patient with, java full.
Hibiscus.
Which you offer to Ma Kali.
Yeah, yeah.
With that, I had seen one. I had a patient whose son was a doctor. So we could not think that what can be the cause. Ultimate history told that Java fool is responsible for that urticaria. Every morning, mother is going to take those flowers from the tree and to offer it to mother
deity, right?
Ma Kali. And when she just avoid that habit, it went away. It's very interesting.
Actually, this means anything under the sun can cause urticaria. I mean, anything
can cause.
can
And
cause urticaria.
moreover, nowadays we are using lots of chemical insecticide that we have to keep in our brain. We are eating, আমরা বাংলায় বলি চকচকে বেগুন.
Polished brinjals, eggplants.
Polished tomato, polished mango, all these cause bogus things. Carbide. They're making using carbide for ripening those mangoes and all
fruits. Yes,
it's causing all types of disease, including urticaria, cancers, different types of cancers, all these things. They are mostly responsible because one patient is taking brinjal from the childhood. Now, suddenly, after 20-30 years, he or she is developing those type of things after taking that brinjal. And usually, we take it from one food vendor who is bringing those bright brinjals and we are eating this.
Right.
So I always ask them to go for some
organic. Yeah.
The brinjal where there is some worms, definitely there is nothing.
No pesticide is there. Okay. We are also getting numerous questions from our viewers, but yeah, because we were talking about the diagnosis. Doctor, now we would like to understand the treatment options available. What are the treatment options for acute as well as chronic urticaria patients?
Someone has asked me for some home remedies.
Yeah, we'll take these questions also one by one.
Home remedies. Home remedies, matlab, you have to prevent all those things. You have to wear loose clothes. That is one thing. Try to wear loose clothes. Avoid all those chemical containing foods. This is very important. This should be done. They can prevent. You can give, if it is not cold-induced physical urticaria, then you can use ice compress. You can use calamine lotion if at all necessary. But one thing you should know that calamine can induce some dryness, which can aggravate the itching.
Right.
So better is coconut oil also. It's a very good home remedy. At least that will not make the skin damage. Skin will not be compromised. If the skin is compromised, then there will be more itching and there is a chance of getting secondary infection. That you have to keep in your mind.
Feroz Khan is also there, doctor, and his question is, are there specific foods that can cause urticaria? Because many a times people say that don't eat, as you mentioned, brinjal or tomatoes, or there are so many things. We'll say nuts, cheese, eggs. Don't eat these things; they'll cause allergy.
Yeah, they may cause. They may. It is not always that they are causing. They are the positive foods. Then you have to go for the specific skin allergy test, whether they are causing this type of urticaria or not. And if they can cause this urticaria, whenever you are taking within 48 hours, you may get the symptoms. If it is not, then they are not responsible. Definitely, they are not responsible. What I told that sometimes I say that you don't eat brinjal. I was taking brinjal from my childhood.
Right.
Why not now? Because at present I am taking that bright choke begun. There is some chemical insecticide that is changing the chemical structure of the brinjal, which is foreign to our body, and our body is responding in that way. That is urticaria. That is the reason of urticaria. So big brinjal is not responsible. That choke brinjal is responsible. Sometimes I say, don't eat prawn. I am eating prawn from my childhood. At present, we are exporting the prawn and pushing injections, different types of injection within that prawn to increase the weight. And that is causing the urticaria. So prawn is not responsible. That injection, what we are pushing, that we don't know what they are pushing. They are causing all those things. Recently, you have seen a few spices have been banned in America, USA.
Right.
I will not tell the names. See, we are using those things. I don't know whether they are right or that company is right. I don't want any controversy, but they have already banned it. They are telling that contains some carcinogenic material.
So that is the thing. So it's not the nature, it's us, because we have made
Anything
those
can cause
injections,
it.
those pesticides.
Anything may not cause it, and that depends on your
Right.
own immunity response. And I have one thing out of the way. I have seen after this COVID and COVID vaccination, lots of urticaria cases, allergic disease, autoimmune diseases have been increased. Lots of cases with autoimmune diseases like alopecia areata and vitiligo, all these are coming more and more. Probably they have got a relationship. They have changed the structure of the immunity and they have deviated the memory of the immunity. They have forgotten that this is my enemy and this is my friend. So they are choosing their friend as enemy and they are killing them.
Right. There are two of our viewers have asked similar questions. I'll take their questions. Pooja Sharma is there. Can urticaria cause complications? Deepak Saksena's question is, can urticaria be life-threatening?
Yeah, definitely. It can be life-threatening because it may induce life-threatening response. It can choke our respiratory system. Then it is life-threatening. Okay, it may cause life-threatening symptoms if the patient says that I am feeling some respiratory difficulty. Then definitely you have to think about it. The patient has to give the definitive treatment for that. You have to give epinephrine. You have to admit the patient. You have to give oxygen and all these nebulizer, all these things to alleviate the symptoms as early as possible.
So, how urticaria leads to such high levels of complications, doctor?
Because immunity actually not affecting only the skin, it is also affecting the inner system also.
Okay.
And that is choking the respiratory system. There is secretion of excess mucus within the larynx, which is choking the total larynx, total respiratory symptom. That is the response. And mainly histamine and mast cells, they are the responsible particles or responsible cells, though mast cells, which giving those histamines and all those inflammatory materials which choke the larynx, which may also be present on the skin.
Right.
That is the cause of both the things, both urticaria as well as the choking of the respiratory system.
Right. That makes it even more important to go and consult a doctor. So at least doctor will make us aware.
We always ask any urticaria patient whether he or she is feeling any choking experience or there is a difficulty in
Respiratory problems,
deglutition.
breathing problems.
Yeah, definitely in difficulty in deglutition or the voice is choking or not. This thing we should ask.
Okay.
There may be swelling of lips. Then you should be cautious that there may be angioedema also.
Okay,
which can
so
cause
that's
this type
also
of
part
response.
of that's also a type of urticaria.
Yeah. Hmm.
Okay, right. Doctor, because before taking viewers' questions, we were talking about treatment options available. And one very common question that people or patients of chronic urticaria often ask that will it ever go away permanently? Because, you know, chronic is like chronic. So, what's your answer to that?
Suppose we have seen that egg and prawn, these two are responsible for urticaria. We always ask the patient to avoid those foods for at least 6 months. Then after that, we can start anyone very slowly. Suppose we ask the patient to take, what I do, I ask the patient to take only the half portion of egg once a week, then twice a week. In this way, we can increase. Or after some specific skin test or allergic test, we can go for, and nowadays vaccination is also available in a few places, in some allergy centers. There we can go for vaccination also. In that way, we can reduce the symptoms. But it is better to just avoid all those things.
Right.
Because you don't know what will happen and whether which type of egg is coming, which type of prawn is coming to you, and what you are consuming. In our country, it is
Absolutely right.
not, the quality is not always very well controlled, including the medicines. Sorry to say.
That's No, I completely understand your point, doctor. Many times patient complains that their urticaria get worse during night.
Yeah, maybe it may happen because sometimes house dust mites are very much responsible. So with the other thing, house dust might also may be responsible. So how whenever you are house at night, so it may cause. The mites are also exerting the symptoms.
Right. People who are suffering from urticaria because they are continuously itching many a time because and it do hampers their personal life, their social life, their standard of living, their life quality. They stop socializing, they stop going to public functions because they're continuously itching. And thus when a patient comes to you, I'm sure he or she is under so much of stress. Does this stress, doctor, also aggravate urticaria?
Absolutely, what I have told you, stress is another factor. So itching, stress, again itching, stress, again itching. Is just like a spin.
Vicious circle,
Just,
yeah.
so we have to alleviate the symptoms. We have to counsel the patient also, and we have to give something so that the patient can get sleep at least at night. There's a few antihistaminics are there which can also alleviate the anxiety, as well as it can produce some sleep that will give much relief to the patient, because it takes some time to get the result, complete result of the antihistaminics.
Right. Many times urticaria patient also complains that they are feeling very tired or fatigued all the time. Is there a correlationship?
Definitely. If you don't get sleep, you are always anxious, you will definitely feel that
You're
tired.
fatigued or
I
tired,
don't
yeah.
want to do some work.
Mm.
It is
Right.
very common because quality of life is getting hampered. Quality of life is getting hampered. It's a chronic thing. It's not that once you get it goes away. It's not like any malaria fever. It's a chronic thing. For that reason, the
Okay. We saw like during COVID, many patients were complaining of urticaria or hives, rather,
itching disorders, many types of
Yes.
itching disorder. There may be papular urticaria, all these types of things. Mainly, these are all autoimmune diseases.
Many
Because
times people
immunity was
who have
drained.
just encountered viral fever or something, we also see urticaria in them as well. I mean, hives and urticaria.
COVID is also one type of viral disease. No? In any type of viral disease, you may experience this. In dengue also. Dengue rashes will be there. Any viral disease. There are thousands of types of viral disease. In any fever, you see that types of teaching
So,
disorders. Because
for
it
example, a person is having, say, any kind of viral and he or she experiences hives. What should he or she do? I mean, go and consult a doctor right away or wait the fever to,
no
go away?
reason to wait. No reason to
Okay.
wait because both the conditions should be treated because these are condition due to that viral disease.
Okay.
Lots of patients are now coming with viral diseases with rashes. So we
Hmm.
have to see whether what type of disease he or she has. There may be cytomegalovirus. Otherwise, it may be dengue, it may be COVID, it may be other things also. Cytomegalovirus may be there. So rashes may be there in any types of disease. It may be measles. It may be measles also. Maybe mumps. All these
Hmm.
are viral diseases. So there
Right.
will be some what skin response will be there.
Hmm. Nowadays, doctor, people are so informed. Everything is a click away. Everything is on their palm.
We're
So
talking about Google doctors.
the thing is, I'm sure you have also
It's
experienced the
better
same
to
because
know
many times
everything.
people,
It's better to know everything. But you first consult doctor, then you go for Google doctor things.
right, right,
I
you're
I personally always ask the patients that first you consult me, then you see the Google and Google. Then again, if any query you ask me, then you will do everything.
huh,
That
but
is
what
better because I
happens?
know that patients will go and see whether the doctor is taking
Giving me the right medication or not.
telling
Many times, what happens, doctor, is that because they are so informed and there are allergy tests so easily available, almost every lab do it. Do we still have you, Dr. Chanchal? Are you there? So we'll wait for our doctor to come back. So we are talking about urticaria, and one very important thing about urticaria is that it itch a lot. It will definitely hamper your quality of life. So you need to go and consult a doctor rather than wasting your time on home remedies or over the counter medications. Plus, urticaria can be life threatening if left untreated. So again, it's very important to know and understand what is the cause and what are the treatment options available. And as doctor was saying, there are treatment options available in case your urticaria is chronic. Of course, you need to have some patience level, because it will take time, and if the cause is known, if it's easy to treat. If the cause is unknown, because in most of the cases, especially in chronic urticaria, the cause is unknown, then the treatment you know is more. So we were talking about urticaria, and in case you have urticaria or similar symptoms or signs, which is like a raised bum, which is going to itch a lot, please go and consult your doctor. That's really important. Miss Dr. Chanchal Bhar is back with us. Are you getting my voice, doctor?
Hello.
Yes, doctor. So,
Yeah. The line was disconnected. Right?
no problem, doctor. It's glad that you are back. One concluding question before we sum up the whole session, doctor. What take home message or precautions you would like to tell our viewers for urticaria?
You should be cautious. Always wash your hands before taking any food. Don't bite your nails. Always brush your teeth twice. Always wear loose dress like me, not fotua, but loose dress. Use soap which has a pH of around 5.5. That means some acidic soap. So the skin will not be compromised. So if it happens also, then there will be less itching and there will be minimal infection. These are the things you should remember, and try to have some organic foods. Organic foods, that is very, very important.
Right. Thank you so very much, Dr. Chanchal Bhar. It was wonderful talking to you. Thank you for your valuable time. It has been a very
There was no
informative session for our viewers, and I'm sure. Yes, doctor. Thank you very much.
That's God.
Right, doctor. I'm sure they'll use the information to prevent themselves and their near and dear ones from getting urticaria. And in case if they get to see such symptoms, at least now they know that instead of self medications, it's always better to approach a nearby qualified dermatologist. Thank you, doctor, once again. And viewers, thank you for your active participation in today's session. To get latest updates on how to keep your skin healthy, do like and follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great day ahead. Goodbye.